Okay, hi there. It will be my first time live in English. Why? Because I thought having so many friends worldwide, yes, you got me, worldwide, I still understand you are missing some information, like which I'm sharing in Facebook. And yeah, thanks to Facebook you can read in any languages you can, like it can be even Turkish, Thai, Chinese, whatever when I write. But sometimes I put some videos which of course you don't understand, and I would like you to know like my new transitions. So like actually that's life is just about my new transition, about my new spirit. Actually it's even not new, because I came back to my roots. I came back to where I started with. So it was always, as you remember me, it was always about health. I was always thinking about people health, about people beauty. Mostly, yes, I was working last years like in girls beauty industry. I mean, okay, it's not girls or men's, it's beauty industry. But now since February this year, I started to work quite hard and close to one Norwegian company. They invited me to be collaborated with them as a person with a pharmaceutical degree, and now I have that kind of my passion spreads about that. Like I really cannot stop to talk about that, but mostly I do that in Russian and sometimes privately in English. So I decided why I should stop. Why I didn't let you know what I'm working with, because this project let me work with all over the world. Like we have really very good base in US, in UK, in Canada, and all Europe, and now open China. Very soon will be open Korea, Philippines, and Portugal, and so many countries. So what makes me so inspired, and I really cannot stop to talk about this company and what I'm dealing with. What is exactly? I'm back to, as I said, to recovery people's health, but exactly it goes to holistic. As you remember, I was working before for the big pharma, and of course while I was working I see still so many questions which we cannot solve thanks only to pharma, because there are some ends and we don't have many answers to some kind of questions. So people just go round and round and cannot see how it can be transferred and how to make the quality of life higher. So when I started to read about this more and more deeply in like scientist projects and PubMed, in other books, like actually like for now this is one of my Bible, this one and another one and this one. With this author I was actually meeting this June, and he's working for our company. He's actually takes care about kingdom family. I mean in London, about all these queens and all others family. So he is the one of who takes care about them. Also he's in charge of pharmaceutical all new stuff and everything. So he works for our company. Under him there are also so many people, scientists, so he's like head of that. And what exactly we are doing, like now we do tests, clinical tests. Like we have 3 tests now. It's the main one, balance test. It looks like this. It's how it's done. It's done on dry blood. So we do only like 2 pricks, 1 prick, and do with dried blood sample. Then I send it to Norway, and then it's analyzing. You cannot go yourself to that laboratory. Why? Because it only works with Oxford and other universities and with other scientists. So I mean, you cannot just be in Oslo, just go to that laboratory and do the test. Like for simple people, it's not possible. But thanks to our company, you can do that, and you can do that very easy. Just being at home. I mean, like I can send this test, even I don't need to go to post office. I just can send you link. You can do that at home. It takes about 10 minutes for all, actually, just to do the prick. And okay, somebody needs me. And then it dries. We put it in a special envelope. I mean, it's everything inside included. And then you send to laboratory. I just need your code, and then I can help you to say about results. What I can see in that test, and what is the difference between laboratory, I mean, normal laboratory, which we get used to, which we used to go when we give blood from the from vein. This laboratory can see only results like now. What you eaten yesterday, what is happening in your body now. What is the difference with this test? With this test, I can see your future. I can predict your future, like for 1 year ahead, 2 years, 3 years, 5 years, sometimes even up to 10 years ahead. So none of others normal laboratory can do that. Also, that's why, like they say, when you come to laboratory, you have to be on empty stomach. With us, no needs. So you just can be even drunk, you can come from the party, you can do that nighttime, evening time, morning time, after the food, before the food, which makes it much more easier. Also, which is much easier because we use only finger. You can do that for your child. So I know many kids, they are really struggling with going to laboratory because they imagine those people who are in a white clothes or other clothes, who are using big needles, using big syringes to collect that blood. And yes, that already makes people afraid just to come in. With this test, it's very easy. It's very simple. It's but the most important, because we can see your future. For example, like last cases, I could see that person can have a stroke or heart attack or diabetes second type. I can see that I can predict it from 1 month to 1, 2, 3, 4, 5 years. And what, for example, happened recently, not exactly with my customers or patients, it's happened with my colleague patient. So she checks the test, she calls the person, she says, like, really, you are not very good in your clinical results. And I see, like, stroke is just behind the corner. It's just really next to you. Unfortunately, that person didn't believe you. She didn't take it close. I don't know why. What's happened? In 20 days, she got the stroke. Her half of the body was paralyzed. Her talking ability also, it's just disappeared. So she couldn't talk. Just one question. Do you think who was the first person when she started to a little bit come back? Who was the first person she write to? Because yes, she cannot call because she was not able to talk still because it was paralyzed. So the first person she write message, it was my friend Olga, and she write to her, please tell me, what did you say I should do, which I didn't listen to you. Yes, and she said her program. Of course, she was in emergency. They did all drippings, what they needed. And then she's back to normal life. I mean, now she's recovering little by little. But what could happen if that person listened to my friend before? Maybe, because 20 days, it's really short period. For example, for changing blood, we need about 4 months. But maybe if it would happen like 2 months before, I'm sure if she would do the test and listen to my friend, she's like mostly people who I'm working with, it's like people with medical degree, medical, pharmaceutical, as I am, yes, or it's nutritionist or other people. Yes, we still have in the company people with not medical degree, but mostly we work with people who really in charge and understand what we are talking about. And why this test is so powerful, like last, I would say 17, 20 years ago, it's really done a lot of job. Like today I was actually on one of conference which held in like, I don't know how many languages, maybe more than 12 languages. It was English, Spanish, Polish, Turkish, Russian, French, German, Czech, many languages. I was even checking just to see how fast and how good it's translating. Okay, I don't understand Turkish, but I can listen. So it was really nice translated. And for example, Australia works very nice with this test, especially for moms who wants to be a mom, for moms who are already pregnant, for girls who breastfeeding, and we see how we can enhance those health. So with this test, what I can see, everything about cardiovascular disease, it's like stroke, heart attack, diabetes. I can check also, we also work with kids, mostly kids, who has autistic syndrome, like also epilepsy, and a lot of this stuff. I can check that before you get that. So I see the dynamics of your body, and when I get result, I can tell you, like, if you don't change your life, how it's going to be, what you're going to have. Like, okay, maybe not in 1 year. I cannot tell you like, okay, it will happen in 1 month or in 3 months or in 1 year, because everyone's bodies is really different. But what I see the tendency also nice, is really nice tendency, because normal laboratory, I mean like normal, like which you get used to, started also to work with us. So some laboratories, like for example in Spain, we work with, they do, like, you can come and do the normal test when they take your blood from the vein, and then also they use this test like just to predict your future, and they can use like vein blood, or they can use this blood, and this they send to us, and then we analyze it. The laboratory we work with, it's biggest laboratory in the world. Also, all correlation of all machine like apparatus for other normal laboratory are being regulated and controlled, and I forgot the English word. Like for example, once a year they need to do like maintenance and to check is it those machines working properly. So who does that? Our laboratory does it. It's Vitas laboratory. So who is in the medical chart, in medical degrees? Yes, you definitely know it. So it's one of the most powerful laboratories in the world. Like every day they get about 30,000 of results, 30,000 of tests, and yes, they give us a lot of results. So far we have 3 tests. Like one I showed you, it's like balance test. I believe this is the most important test in your life. It's like DNA test, you have to do that once. Balance test, definitely you have to do that. Also, we have test about hemoglobin, about sugar. I can check, like, are you going to diabetes 2 or not? Because now it's like, I would say every third person has diabetes. Also, we work with diabetes 1, where you need, like when you use syringes. Why? Because it has targets like to your skin, to your eyes, so at least we can stop it or make it not so fast developed. That's what I work with also. And another test we have about vitamin D, which is one of the not good correlation. I mean, for example, in normal laboratory you can have about 40% not correct answer. It's one of the difficult tests. So we have with only 4-5% mistakes comparing to normal laboratory, which you get used to. It's about 40% not correct answer. And this autumn, we are waiting for the first in the world test about microbiome. I don't know if you have ever heard that, how it's done. Like, it's usually done by poop, and it's quite difficult test, but ours one will be by blood, same done by dry blood. So we are waiting number 4 test. I think it will be launched when we will be in Oslo in October. And it was done about 8 years. They checking how to do that, then they stuck, and then when one more scientist added to our company, and they just changed the world. So I'm really happy to work with this company, and I'm really happy to share my knowledges, to receive new knowledges from very powerful people like for example, Paul Clayton, this one who I was telling you. He is in top 100 doctors in the world. So like, I was talking to him, he will even signed me this book. So I'm really happy to work for this company, and I believe I have to also write in English more, so you don't need to use translation when I write it in Russian. And I'm more than welcome to answer your questions. You can do that private, you can do that in under this video or whatever. And I think I just have to do some kind of short lives about some stuff, so you can also learn that with me. Because what I see, the efficiency of omega-3, correct omega-3, not like 95% which is on the market, which is shit, which you don't even need to use your money, your energy, your time, even don't spend to that. But okay, to describe that there is a kind of useless stuff, you probably have to write a little bit more about that. Yeah. And we also have some other products, and I see every day a lot of good results. So sometimes even like, I'm from medical degrees, yes, even sometimes I have goosebumps, because I cannot believe, like, sometimes people, they have problem like 10 years, 15 years, they've been around and round and round in medical, in going to doctors, doing analysis, clinical analysis tests, a lot of going here, going there, but because I was always watching to that holistic way. So for me, I always was understanding we cannot treat, for example, second finger of right hand. No, we have to treat all the body. Maybe it came also because my grandfather, he was kind of, I don't know how to say in English correct, like he was treating people with herbs and other stuff. So I already like inherit have that in my blood. And while I was working for Big Pharma, also I was working with a lot of hospitals with like different parts. It was like urology and psychology, psychiatric and oncology, and infections, and kidneys, and gynecologists. Like, I would say I worked with all departments. Like, I was working with doctors, and also I was working with pharmacists and pharmaceutical, I mean pharmacy people, and like I was teaching them, and we were doing congresses, and yeah. So like, I was working for one Ukrainian company and also for Australian company for a part, for a while. So I see how many problems can be. I see how much raised, for example, heart attack and stroke, especially in the men's side. For example, within last 20 years, young guys, I would say young guys, because between 25 till 35, 40 years old, I would say it's a young guys. So it's stroke raised about 40%. So even if we go 20 years ago, we wouldn't see those young people in cardiology department. No, we would say people with stroke, it's like 50, 55, 65. So nobody would imagine 20, 40, 50 years ago, young people with stroke. Now we have it. And as you know, I think it's not a new knowledge. There is first kind of disease from where we have lethal, like from where people die, it's cardiovascular disease. Like I think first 2 or 3 levels, it's everything about stroke, heart attack, and all this. So I'm working with this. I can analyze, and not only analyze and see, also we work to treat it. So I don't want to make today life long one, because I understand also you didn't see me really long while, unless you you are talking to me in private. Yeah. So for today is all, but I would like to see your replies, comments, private or under here. The only thing is live in Facebook, it kept only for 30 days. So after that it will be automatically removed. So if I see your interest, that makes me more, like charge, okay, you like keep going, I will do that and share with you more. Thank you and have a good day, night, morning, whatever, because I know you are all over the world here.